Okay, this is revision session 3 for medicine, or history of medicine, 1250 to the present day. This session will focus on medicine from 1700 to 1900, or the industrial age. Again, as with all of them, I'm going to start with the key terminology to do with causes, treatments and prevention. And then I'll move on to IIAS, individuals, institutions, attitudes, and science and technology. Then the case study, which in this period is cholera. And then we'll have some notes on change in continuity, and I'll try and get through it all in 20 minutes. When you're listening to this on YouTube, you should be trying to pause it and just make sure your notes are all coherent. Okay, so I'm going to go through it quite quickly, but you might want to have your finger on the pause button. So, first of all, causes. People still believe in miasma at the start of this period. Towards the end of the period, miasma has been debunked by germ theory, but to begin with, miasma is still a popular belief about cause. This is linked to, it's not instead of, it's kind of linked to the idea of spontaneous generation. Eventually, microscopes become powerful enough for people to see animalcules or microbes or bacteria or germs or whatever you want to call them through the microscope. So they know they exist by the early 1800s. The only thing is, we're not sure why they exist or how they exist. And there's two theories. One is germ theory, that they get into, germs are in the air around us and the dust particles, and those germs then settle on whatever is around, milk, urine, wine, whatever is lying around, and they will cause the decay. Or the other theory is the spontaneous generation, which is that the decay causes germs to exist. So things will go bad, and it's that badness that causes the germs to exist. Now we know that that's not the case. We know that spontaneous generation is untrue. But to begin with, this time period, or certainly early 1800s, spontaneous generation is a real theory about the cause of disease. By 1860, scientists have kind of gone beyond germ theory, although some doctors, you'll see down at the bottom right of the slide, higher level detail, you've got Henry Bastian. Bastian is one of these doctors who just really will not let go of the idea of spontaneous generation. And as late as the 1880s, 20 years after Pasteur published his germ theory, he's still clinging on to that idea of spontaneous generation against all evidence to the contrary. So it's a lot of change really there in the ideas of causes. At the beginning of this period, we're still believing in miasma. By the end of the period, we're all about germ theory. Treatments then. First of all, Florence Nightingale improved hospitals. That was a big contribution. Don't just think that she is all to do with the Crimean War and nothing else. She came back from the Crimean War and revolutionised hospital care. She improved the design of hospitals. She was consulted on the design of hospitals. She improved hygiene, improved the discipline of nurses, professionalised nursing as a job, as a career, as a profession. She's famous for the work that she did in Scutari in the Crimea, where she oversaw a decline in death rates from 42% to 2%. She wrote her notes on nursing, and she founded the Nightingale School of Nursing. Mary Seacole is another famous nurse. She wasn't as famous at the time, but sort of later revisionisms of history have raised the importance of Mary Seacole. Maybe it was because she was of Afro-Caribbean descent, but she was kind of overlooked a little bit. So we're trying to put that right as historians. So I mentioned Mary Seacole as well. She founded the British Hotel. She did very similar things, coming at it from a different angle. She built this British Hotel, and she went out into the battlefield and looked after soldiers who'd been wounded, soldiers of both sides. But Nightingale's influence was more far-reaching, because when she came home from the war, she used her contacts. She was very well connected. For example, Sidney Herbert was certainly a family friend, if not a relative, and he was Minister for War, and it was through Sidney Herbert that she managed to get funding to take her nurses out to the Crimea, because she used these connections when she came home from the Crimea to found the Nightingale School of Nursing and get her notes on nursing published. So she was able to have quite a far-reaching impact. So individuals helped Nightingale to achieve what she wanted to achieve, and one of those individuals is Sidney Herbert, so be aware of that. Sidney Herbert is one of the individuals that I mentioned later on as well. Another new treatments to do with surgery. We've got anaesthetics, antiseptics, and improved methods of diagnosis. So let's begin with anaesthetics. First of all, the first anaesthetic that we come across really beyond basic opiates and alcohol is nitrous oxide, better known as laughing gas. That's Humphrey Davy who comes up with or applies that to surgery. Humphrey Davy, he's laughing gas or nitrous oxide. And then we've got the problems with nitrous oxide. It doesn't keep you still. It makes it so it makes the patient not care so much about the pain, but it doesn't keep them still. So they're still thrashing about, and they can still lose blood, and it can still be dangerous. The next advance on that comes in 1846, and that's ether. And the guy who's responsible for ether, you'll see him on the individuals board. That's Robert Liston. Robert Liston is the guy who comes up with ether. Ether's okay, it's better than laughing gas because the patient is knocked out, but it irritates the throat, and patients cough even when they're unconscious, and their body shakes. So again, it's not 100% safe. The other dangerous thing about ether is it's flammable. So any naked flame, and this is a time when gas lights were used and candles, any naked flame, and the whole thing goes up in smoke. And the last one is chloroform. This was more successful. This is James Simpson, is the guy who came up with chloroform, 1847. So running around about the same time as ether. They were kind of, they were around at the same time. James Simpson faced a lot of opposition to his chloroform. You need to be aware of this. A lot to anaesthetics generally. Soldiers, for example, high-ranking soldiers, generals, they thought it was a bit wimpish to kind of go for anaesthetics. They thought it was a more manly thing to do was suffer during surgery. Religious believers, particularly to do with childbirth, they believed that anaesthetic was wrong because pain was sent by God and you should suffer it. It was a purifying experience to suffer the pain. Other reasons to oppose anaesthetics were to do with the dangers faced by overdosing. Hannah Greener was a 14-year-old girl who was the first to be killed by an overdose of chloroform, for example. So there were good reasons to oppose anaesthetic. But in 1853, Queen Victoria was given chloroform for the birth of Prince Leopold. 1853. And after that, nobody would dare criticise the use of chloroform or anaesthetics during surgery. If the Queen will use it, then you will not insult it. So after that, anaesthetic became pretty well used. The only problem with anaesthetics, it's a strange thing. Up until anaesthetics, we have a death rate during surgery of about 40%. Okay, that's a nice statistics worth remembering. A death rate during surgery of about 40%. Now, after anaesthetics start being used, after 1847, we get this strange spike in death rates. Death rates actually go up. Now, it would be really useful if you can remember that, and really useful if you can apply it. Death rates go up because patients are asleep during operations, so surgeons think, well, if they're asleep, I can do more, I can be a little bit more invasive. So surgery's become a little bit more experimental. And that's okay, that's fine, except that anaesthetics came before antiseptics. So what these surgeons were doing is they were doing more experimental, more invasive surgery, but they weren't cleaning their hands and they weren't cleaning their equipment, so they were taking infections deep into the body. So there was this rise in infectious or infection-related deaths. So strangely enough, in the long run, anaesthetics were brilliant. In the short term, anaesthetics actually inadvertently led to a rise in death rates, and that'd be a really useful thing if you can, when you're evaluating anaesthetics, if you can kind of draw attention to that, if you can mention that. Great in the long run. Obviously, it lowered death rates. It was brilliant. Meant that surgery was safer, more straightforward. But in the short term, it meant that there was a spike in the incidence of infection-related deaths. So there was a need to improve that and enter antiseptic surgery. This is Joseph Lister. Now, what helped Joseph Lister come up with his ideas? Louis Pasteur. If Louis Pasteur hadn't developed germ theory, and if Joseph Lister hadn't read about it in the press, so I suppose the importance of the printing press is still viable. Joseph Lister hadn't read about it, improved communication, etc. Then Joseph Lister wouldn't have applied his beliefs to his surgery. Joseph Lister was also helped by his knowledge that a carbolic acid was added to sewage to remove the smell of sewage, and he kind of put two and two together, and he thought, well, let's try carbolic acid and see if it kills germs in hospitals. And he tried it, and it did. It worked. So there was this sort of attempt to use carbolic acid to clean surgical equipment, and he invented the carbolic spray, so that during surgery the carbolic acid was sprayed throughout the operating theatre. And this was antiseptic surgery, not to be confused with aseptic surgery, which is what we have today, which is no germs are allowed to get into the operating theatre at all. And he found, another nice statistic, he found that he had a improvement in life expectancy of 2/3, okay? So his death rates, if you like, after surgery went down by 2/3, which was an enormous improvement. And he wrote about this in the British Medical Journal, the BMJ. So you mentioned that Joseph Lister's impact was great, because, or so much greater, because he wrote about it and he had his work published in the BMJ. Remember, it's important to note some of these journals and books, and the BMJ is a good one. Rather like Philosophical Transactions was the magazine of the Royal Society, the BMJ was a new magazine that was published by the medical establishment, and Joseph Lister wrote about his findings. Unfortunately, not everybody listened, because we've still got people like Henry Bastian running around saying that spontaneous generation is correct. So not everybody listened, and Joseph Lister was actually attacked by many doctors, one of whom was actually James Simpson, who was a hero in terms of anaesthetics, but he didn't believe in antiseptic surgery. So it took a while, it took a struggle, but eventually Lister was vindicated, and antiseptic surgery became very popular. Yes, but I'm recording it. You're now on YouTube. Right. Another development was... that's all right. That's fine. Another development was in diagnosis. This is right at the end of the time period, but it's worth mentioning. 1895, Wilhelm Röntgen invents X-rays. Okay. Lastly, prevention. This is taking a long time. I need to pick up the pace a little bit. Vaccines. I'll go into Jenner and Pasteur in a minute. And Koch, because I'll talk about them as individuals, but vaccines are new prevention that's invented in this time period. Cholera, the efforts of John Snow in London. The Public Health Act of 1875 means the end of government laissez-faire. The government is now getting involved in people's health. And Edwin Chadwick is the man who surveyed London and recommended a Public Health Act. So there's a few more names to learn. So prevention towards the end of this time period is becoming more important. Let's move on to individuals. Okay, so there's a few names to get to grips with here. Lady Mary Wortley Montagu was a lady who brought over the idea of inoculation. Inoculation is very similar to a vaccine. It's giving you a little bit of the disease to make your body produce the antibodies to fight that disease should you be exposed to it at a later time. Okay, it's dangerous, inoculation. She discovered it while living in Turkey. People in Turkey were using inoculation to have inoculation parties. People were getting infected with all sorts of diseases, smallpox being one, and the hope was that they would then be immune. So there was an awareness that if you get a disease once, or a little bit of the disease, you may be immune to it. Unfortunately, it wasn't always safe. Some people got too much of the disease and actually got the disease and died of the disease. Some people didn't get enough, and they weren't inoculated. It was unsuccessful. So Edward Jenner came along, and he decided there must be a better way. There must be a more successful way of inoculating people, and he experimented with cowpox. He infected a young lad, 8-year-old lad called James Phipps, with cowpox after he noticed that milkmaids didn't develop smallpox. They did get a disease called cowpox, which he guessed was like a weakened version of smallpox, and he experimented. He was successful. Now his impact was limited in the immediate term. because not many people supported it. People opposed it on religious grounds. People opposed it on philosophical grounds. The Royal Society, for example, refused to publish his findings. That was because he couldn't prove why it worked. He knew it did work, but he didn't know about germs, he didn't know about viruses, he didn't know about bacteria. He just knew that it did work. So the Royal Society didn't publish it, and the biggest group that were opposed to it were the inoculators, the surgeons and physicians who actually made money charging people for inoculations of smallpox. Now remember, vaccination is slightly different to inoculation. Getting a vaccination was getting cowpox. Getting an inoculation was actually getting smallpox, but a small amount in the hope that you would be immune. So those inoculators, those doctors who were charging money for their services, stood to lose money if vaccination took hold. So they opposed it as well. In the longer term, though, it became very popular. In the beginning of the 1800s, the Royal Generian Society, okay, that's a new institution, the Royal Generian Society was set up to try and vaccinate as many people as possible. About 12,000 people were vaccinated by the Royal Generian Society. Napoleon vaccinated his entire army, so it was even going overseas. But the British government were slow to get on board with it. Very slow to get on board with it for the reasons I've just mentioned. Inoculators, religious believers, and the Royal Society weren't really on board until later. But eventually, in 1979, smallpox was declared a dead disease. So in the long run, very successful, that first vaccine. Okay, it was called vaccine because the Latin for cow is vacca, and the Latin for cowpox is vaccinia. So there we get vaccine from. Another individual on the list, Robert Koch. Louis Pasteur. Begin with Louis Pasteur. Louis Pasteur, I've mentioned him already. John, would you mind shutting that window for us, please? Yeah. Thank you. It's a bit noisy out there. Louis Pasteur came up with his germ theory. He proved that spontaneous generation was wrong in 1861. He was a chemist, though, and he was French, so his ideas were slow to take hold in Britain, particularly, because we didn't trust the French, and doctors were reluctant to believe a chemist because they were a bit snobbish about things like that. So even though he published his findings, it was slow to take hold. One person who did listen, though, was Robert Koch, a German who took his ideas and started looking for different microbes. So Pasteur proved that germs existed. Koch proved that different germs cause different diseases. So that's the difference. Koch also came up with other innovations. He used agar jelly so that they could be grown in cultures, in petri dishes, and he also stained them so that they could be seen more easily. He isolated the TB bacteria, and other thing, anthrax. He isolated anthrax. Louis Pasteur then went one further and used Robert Koch's ideas to create a vaccine for anthrax, which he used to save sheep populations across Europe. So a little bit of... They weren't a team, though. Don't think that they worked together. They worked in competition, and it was that competition that actually helped the French government and the French Academy of Sciences, institutions, French government and the French Academy of Sciences, sponsored Pasteur, paid him money, and the German government paid Robert Koch money. So they were both sponsored by their own governments. Note how the British government is not doing anything similar at this time. British government still very much laissez-faire, don't get involved. But they both contributed massively, Robert Koch and Louis Pasteur. And eventually, in 1881, they actually met. They met at a big conference, 1881. Remember the importance of communication? Great minds are now meeting together and sharing information. It took until 1881, though. They inspired other people like Joseph Lister, that I've just mentioned, to do with antiseptic surgery. Another individual on the list, Nightingale, and how she was helped by Sidney Herbert. I've mentioned already, I'll not spend any time on her. Joseph Lister, carbolic acid, I've mentioned him. James Simpson, chloroform, I've mentioned him. John Snow, cholera is this case study, so I'll leave that for now. Edwin Chadwick, I'll leave as well because he comes into the public health later on. And Joseph Bazalgette designed the sewers of London, so I'll come to him later on as well. Institutions, I've mentioned governments, French and German and British, particularly the French and German with regard to Pasteur and Koch. Make sure you mention them as helping influences. And the French Academy of Science. Attitudes, rational observation. Jenner was a scientist. He applied the methods of scientific observation when he spotted that people who had cowpox didn't get smallpox. But we've also got the opposite side, a negative attitude, holding back change. Doctors' suspicion of Jenner. Doctors' suspicion, or inoculators' suspicion of Jenner. Doctors' suspicion of Pasteur because he was a chemist, not a physician. So this is a strange time. There are some attitudes, even though we live in this age of scientific revelations, there are still people who cling to old and defunct or inaccurate ideas. And that attitude can be hard to change. Lastly, science and technology. We've got improved communication and travel, trains, which meant that these people could meet for the first time. Remember, 1881, this big conference where Koch and Lister and Pasteur met and exchanged ideas. Stronger microscopes meant that Koch and Pasteur could see the different bacteria. Koch could stain them and look at them using agar jelly. Okay. Moving on to the case study then, quickly. Cholera. Nicknamed the Blue Death, big outbreak in 1831, 5,275 deaths in 1832, tended to affect poorer areas. You basically dehydrated to death. Okay. Beliefs about causes were that it was miasma linked to poorer areas, logical but incorrect. In 1854, John Snow was the first person to prove that it was a waterborne virus. Now, we need to be aware of what John Snow did. He carried out a map study. He mapped out the cases of cholera, and he proved that they were all around this one particular pump in London, the Broad Street pump. Okay, we call that a spot map survey. Okay, so he proved that it wasn't miasma. He used a spot map survey in 1854 to prove that it was around the Broad Street pump. He had the handle removed and saved a lot of lives. But the government didn't listen. Remember, this is a time of laissez-faire. The government didn't try. There were other cholera outbreaks around the country because the government didn't listen to him. Even though he was telling them it was waterborne, the government didn't listen. He saved the people of Broad Street and the surrounding area, but not the country. He did recommend a new improved sewage system, but the government did nothing. It took until 1858, 4 years later, when we had the Great Stink, and it was more to do with the fact that the Thames was smelly than it was anything to do with John Snow's findings. So the Great Stink finally spurred Parliament into action, and they commissioned a survey led by Edwin Chadwick. Edwin Chadwick looked into the reasons for poor sanitation, and he recommended a public health act. Now, there were two public health acts that we need to be aware of. One in 1848, the first Public Health Act, which was not compulsory. It was basically a recommendation. It was not. It had no teeth. It's advisable to make sure that everybody has clean water. It's advisable to make sure that all sewage is taken away safely and doesn't contaminate your water supply. So it's not really a solution. Local authorities were not obliged to follow it. But in 1875, based on the recommendations of Edwin Chadwick, a new Public Health Act was passed. 1875 Public Health Act. Is that window open as well? Yeah, please. The 1875 Public Health Act was compulsory. All local authorities were obliged to clean up the water, make sure water was provided, and take sewage away. And it was the end of laissez-faire. And when we look into modern medicine, you'll see that 1875 Public Health Act is really the beginning of the government becoming more involved. And we see that getting more intense, right up until the founding of the NHS, the vaccination campaigns and the public health warnings that we see on TV about various diseases and the dangers of not exercising and things, and your 5-a-day campaign, Stoptober and all things like that. It really begins with the 1875 Public Health Act and the end of laissez-faire. Okay, so a lot of change in this industrial time, 1700 to 1900, a lot of change. So I'll just recap on the change and continuity now, the last thing I'll do. First of all, change. This is an age of a search for rational explanations, okay? Spurred on, really, by the massive social and economical upheavals that this time sees. This is the Industrial Revolution. We've got people moving to the cities in huge numbers, and as a result, we've got new diseases. Typhus, TB, smallpox, cholera is one as well. So people are suffering because they are living in overcrowded circumstances. We have a new idea, this spontaneous generation, not replacing miasma, that's not quite right, but sort of operating alongside miasma, taught that germs were the product of decay and not the causes of decay. Now this needed to be disproved, and it was eventually, so we've got germ theory, that's another change. Louis Pasteur and his findings. We've also got new preventions, vaccinations, we've got new treatments, new methods of surgery involving anaesthetic and antiseptic, so you know your individuals and your technology concerned with those. We've got new hospitals, Nightingale, her impact after 1856. We've got new institutional involvement towards the end of the time period as well, with the 1875 Public Health Act, and part of that was the building of the amazing sewage system in London, which is a real wonder to behold. Apparently, not that I've ever seen it myself, but everybody talks about how amazing it is, and you can visit it. And it was designed by this engineer, Joseph Bazalgette, which is a nice name to drop in if you can. That said, there was some continuity, which is worth mentioning. We've got early in the period a continued belief in miasma. We've got this attitude that's a reluctance to accept new ideas, which seems odd to us, but doctors didn't like the ideas of chemists. The British government didn't like the idea of anything coming out of France, and the German government was suspicious of the French government, all that kind of thing. So it's strange barriers to new knowledge. So there is a little bit of continuity. Inoculators opposed to vaccinations and things like that. Doctors worried they'd lose money and all the rest of it. That's really it. I've mentioned Henry Bastian. I've mentioned Wilhelm Röntgen, who's the inventor of X-rays. That's all of it. That's everything done. And we're at 26 minutes.